What an attentive audience. Thank you very much for coming along and being quiet. That's fabulous. So it's just after 2 o'clock, so we're going to get started because we have quite a few people on webinar, which is fabulous. We had 60 people register to listen in from their computers, so we're excited about that. So welcome to all those people in the room and on webinar, so thank you very much. Just a bit of housekeeping. If there is an emergency of any description for those of us in the room, the meeting point is over at the park in the corner over there, and if you need to go to the bathroom, they're down the corridor and on the left. I'm the acting manager of Falls Prevention Program. My name is Emily Anderson, if I haven't met you before, but it's really nice to see some familiar faces in the crowd, but also on the webinar I noticed quite a few familiar faces, which is great. Welcome to the launch of the Make Your Home Safer campaign for Stay on Your Feet. We're really excited about this launch. It's our third campaign for our New Look program. So thank you very much for coming along. I would ask that we probably wait for questions till the end if possible, because we do have webinar people involved. If you do have questions on webinar, please just feel free to write those in the little panel next of your screen. I'd like to firstly start, I'd like to show my respect and acknowledge the Noongar people, the traditional custodians of this land and of elders past and present on which this event takes place. As I mentioned, we are launching the Make Your Home Safer campaign, and if you don't know about our Move, Improve, Remove messaging, this is it here behind me, and we're talking about making your home safer, which fits into our Removing Hazards section. And our key messages for this event, for the whole campaign, are asking about an in-home assessment, letting someone know if you have had a fall, and making sure that people know about our new improved home safety checklist and action plan, and to make a change when you're using that resource. So we're really excited that that resource is now come into fruition and everyone can order it online as of today. I'd first like to introduce our guest speaker for today, Andrea White. She is a senior occupational therapist and a fall specialist at Armidale Health Service. Please welcome Andrea. This one. Okay. Just rearrange the furniture a bit.
Okay, thanks everyone for coming, and thanks to everyone for listening in on webinar. I've worked in the Fall Specialist program for about 6 or so years now, so home safety and removal of home hazards, being an occupational therapist, is very dear to my heart. So what is a home hazard? What are they? Home hazards are any object or physical circumstance that increases a person's risk of falling. They may be within the home or within the grounds of the home. And they include such things as poor lighting, inadequate lighting, particularly at night, but also during the day for those with visual impairment, carpets and floor coverings that are in poor condition, rugs that slip, furniture or clutter that obstruct walkways, extension cords across walkways, unstable or unsuitable chairs and tables or other furniture, slippery floors, and bed furnishings that hang on the ground. In terms of the bathroom areas, other common hazards are baths or showers with slippery floors, a hob or a step over into a shower recess for someone that has a mobility or strength issue, toilet seats that are too low, the location of the toilet in the house, for example, if it's too far from the bedroom for someone that has to get up at night, or perhaps it's out the back, or maybe it's down a couple of steps, and generally slippery floors in those areas. In terms of steps and areas outside of the home, we see steps that are too narrow or too steep, steps that are in need of repair, step edges that are hard to see, again particularly for those with visual impairments. We see steps that don't have handrails installed at all. those that are not stable or maybe in need of repair or don't extend long enough down the step, inadequate lighting, sloping, slippery, obstructed or uneven pathways, and steps, landings, verandas, patios or entrances that are slippery when wet. So why is hazard reduction important and why do falls occur? We know that 1 in 3 older people do fall, but between half and 2/3 of falls occur in the home and the home environment. And we know that older people who have fallen once are more likely to fall again. It's important that older people are aware of simple measures that they can do to make changes to their environment and reduce their hazards. And it's also important that they're assisted to make changes to their environment and their behaviour and activities that they undertake in that environment. Because we know that the older person, their environment and the activities that they perform are all interrelated when it comes to falls. Falls in the home result usually from an interaction between environmental hazards and their physical abilities or risk-taking. And actually, I'll just go back. This way of looking at falls fits well because of the multifactorial nature of falls. So older people undergo a number of age-related physiological changes that interact with their existing disease processes and their impairments, and that then limits their ability to compensate or to not fall when they're exposed to a hazard or a demand in their environment. So those with poor balance will only cope with a low level of environmental demand. Those with good balance will obviously cope with a higher level of environmental demand. This is then complicated by issues such as cognitive impairment. So generally those with a cognitive impairment will require an environment with a low environmental demand to allow for the difficulties they might have in decision making, perceptual deficits and balance changes that occur and may not be modifiable. The interaction between balance and environment is quite critical too. So for those with dementia, as they become more cognitively impaired, not only is their environment, their normal environment, quite challenging, but they would find it incredibly difficult to cope with a new environment, and that will therefore be much more hazardous. So the more overall risk factors a person has, the more likely they are to fall. So reducing risk factors will reduce the risk of falling. Home hazard reduction is most effective if it's targeted at older people who have a history of falls, a visual impairment and or mobility limitations. So what can be done? It's important to review the home environment using the home safety checklist and then making changes to the items that you've identified, and then, if required, seek referral for a further assessment. So the practical things that a lot of people can do themselves are things such as removing mats, cords and clutter, using non-slip mats, having grab rails installed in the shower, toilet or at steps, improving lighting and using night lights, highlighting the edges of steps, improving bed and chair heights, cleaning up spills immediately and maintaining their pathways, removing clutter such as pot plants, etc. And with respect in particular to rails, grab rails, it's really is best to seek assessment so that rails are positioned in the most suitable location depending on the need. So there's a number of different reasons why a rail might be required, whether it's for balance or basic support, is it at a step, or is it to assist someone to get up from a toilet. So the positioning of a rail will be different depending on the identified need. And it's also important that rails meet the Australian safety standards and that they are installed correctly. So there are many variables as to how and where a rail would or could be installed. Environmental modification also has proven evidence as part of a multifactorial program of falls prevention. And most evidence-based falls programs, such as the Falls Specialist Program and falls clinics, will generally offer a multifactorial assessment and interventions. Environmental assessment and modifications should be one of those interventions that are offered, as fallers in these settings are likely to be in that high-risk category that I mentioned earlier. Training, education and follow-up are imperative for successful uptake of home modifications. And again, research has shown that without that education, so helping the older person understand why they need to make those changes or why we should assist them to make those changes, and follow up, without those, the uptake of home modifications is actually quite poor. So home modifications must also be matched with a change in behaviour to help manage those risks. If they continue to perform their risk-taking behaviours, such as standing on wobbly little ladders to get to the top shelf, then they may in fact still continue to fall. So does your home look like this? Then maybe it's time for you to make your home safer. Thank you.
Thanks, Andrea. I've got a little gift for you. Thank you very much for your time and effort. Andrea is also a feature, the actress in our our toolkit video. So I'll talk about that a bit later. But thank you very much, Andrea, for your time and effort you've put into our program over the last few weeks and ongoing as well. Okay, so I'd like to keep moving on. We would like first to talk about one of our grants that grant programs that we happened earlier, a couple of months ago now. We'd like to announce that West Arthur Community Resource Centre were the recipient of the Make Your Home Safer grant. They are running interactive workshops for people in West Arthur, so we're really excited that those people were the recipient of that grant. We've had really great success from our other grants programs. Some of the Build Your Balance and Check Your Medicines grants program have continued after the grants period, so it's really exciting to see those programs continue on, and hopefully this one will do the same. Another project that we've been working on is the Falls Educator Toolkit for Make Your Home Safer, and as I mentioned, Andrea is in the videos of this. This toolkit is designed for health professionals and aged care workers to be able to pick up this toolkit and be able to present an educational material to older adults. So it is designed to be like a group presentation talking about making your home safer, although it can be used on a one-to-one type situation. We have some conversation starters because we know sometimes removing hazards from your home can be a difficult conversation to have. We've got the videos to show you how you can present, so you can, if you've never presented before, it's demonstrating how to present. And we've got a quiz and other things involved, and a PowerPoint presentation, so it's all there for you to use. So feel free to jump on and see that one on the website. We've also got the media kit and activities involved within that toolkit, which is fabulous. I'd now like to talk about our home safety checklist, and for those of you in the room, they're on our resources table, and feel free to grab a few copies. But basically it does look like this. If you did know, we used to have a home safety checklist, but it's very much been revamped with the new branding, but also new content. We've worked quite closely with a number of falls specialists, the Independent Living Centre guys who are here today, which is fabulous, helped us review it as well. So thank you very much for your time with that. And feel free to order these. These are now in our resource ordering system, along with new up off the floor posters. So you may have these, we've also had these before, but they've been revamped due to some feedback. And we've also got using your arms method. So previously we've only had one type available, which is a method where you get up off the floor using your knees. We had feedback that many more people were wanting to use their arms to get up because of different knee issues and things like that. So we now have two different resources available, both still with the magnetic strip on the back, because many people put them on the fridge. So feel free to order those as well. And if you do want to order them, jump on the iqaquickmail.com.au website. If you want to order in large amounts, so most health professionals in the room or on webinar I'd recommend doing that, because if you can order quite a number of them. You can also recommend older adults join on as guests. They can order themselves up to 2 at a time. We also have event flyers, event preparation kits and promotion kits that you may be interested in using. If you're holding an event, it gives you some suggestions on what you might consider before hosting an event, and we really encourage you to use all our resources and toolkits and things like that to put on an event to promote the Make Your Home Safer message to the community. I'm now going to hand over to Juliana, who's quickly going to talk about our eDirectory and how you can promote your services. Thanks, Juliana.
Hi everyone, my name's Juliana. I'm the Community Engagement Coordinator for the Falls program Stay on Your Feet. So I just wanted to quickly let you know about our eDirectory. So this is also another resource we had previously that we've updated. It's basically just a resource that's on our website, and programs can use it to promote themselves, but also services and also events. And at the moment, we're trying to really push people to promote their Make Your Home Safer events. So if anyone is running events where the public is welcome to attend, we'd really love you to sign up to our website. And anyone who does sign up is going to get a free box of pens.
It's always a winner, the pens. Everyone loves a merch item, but we really encourage you to hand out our resources and give some education as well as giving out the pens. Thank you, Juliana. We also have another education event coming up in April, which is the Make Your Home Safer Forum. The last one was really successful, the Build Your Balance Forum. We had many OTs and physios and many different disciplines coming along to come and listen to Build Your Balance, and we're expecting similar things to happen with Make Your Home Safer Forum. It's a really good opportunity not only to learn some new information, but as a networking opportunity as well. So once again, keep an eye on the Stay on Your Feet events page to find out more. Just wanted to give you a heads up about the Falls Prevention Grassroots Conference. We've just recently decided on some dates for that. If anyone attended the Grassroots Conference at the start of 2015, February 2015, it will be along the similar lines, but we're hoping to make it bigger and better. We're partnering with Sir Charles Gardner Hospital, who put on the first one. So if you've got some programs or projects that you'd really like to promote that's happening in falls prevention, this is a great opportunity. We're really looking for on-the-ground projects that we can share with everyone. So watch this space. And another couple of our strength and balance training, the LIFE program, or the LIFE, I always forget, Lifestyle Integrated Functional Exercise program is happening in May, and the Otago program is happening on the 24th of March. Both these programs last year were sold out by the time they went to be delivered. So if you're interested, give it, and don't know much about them, please feel free to contact us or sign up if you're interested to attend. They're both half-day courses. And just a heads up, if anyone's interested to come to our Tai Chi for Arthritis follow-up instructor training this Saturday, yep, just this week. Come along. If you've been trained in the last 2 years, you're more than welcome to come along and have a follow-up. We found people were keen to practice with fellow participants before they went and delivered to the community, so we're really encouraging anyone who's interested to come along. Yes, our sign-up will be by the end of this week. And there'll be further information about full Tai Chi for Arthritis courses that will be happening approximately mid-year. So once again, contact us if you're interested. If you want to know more about Stay on Your Feet or falls prevention generally, if you haven't visited the stayonyourfeet.com.au website, I'd highly recommend it. There's a quiz, you can test yourself on the various campaigns and the information. There's a section on what works to reduce falls, so not only on Make Your Home Safer, but all our other areas of our campaign and projects. And there's evidence and reference documents, so if you're ever looking to see what's best practice and what's happening right now, feel free to jump on our website. If you're not part of our e-news listing, please feel free to let us know or sign up here if you're if you sign up here, and we can send you all our newsletters. We send them out every fortnight, although tomorrow if you're on our listing, you'll be getting our special launch edition. So it will have a video of this presentation, Alma's video, which will have sound, I promise, and all our links to all our resources and education events that are happening. So please sign up to that. We'll also, within that e-news, have a print-friendly edition. So for those who aren't on email, or you want to print off and leave on a staff table or something like that, do that as well. But that's it for now. We really want to thank you all for coming along and launching our Make Your Home Safer campaign. We think it's going to be bigger and better than ever, and we think it will resonate with lots of people and hopefully get some people removing some hazards from their home. So thank you very much for coming to this event, and it's great to see you all, and please use our resources and share the information that we've given out. Thank you.